helping you lead a healthier life. This is CURES.
Hi everybody, it is time now for the CURES Show, where we explore the cutting edge of wellness for our mind, body, and spirit. I'm Kara Sundlin. Today we're talking about an issue that is so common for a lot of folks, especially women, annoying, stubborn acne. It can even happen when we are an adult for the first time. So joining me now is Naturopathic Doctor and an expert in integrative medicine, Dr. Jennifer Stagg. Thank you so much for being with us.
Thanks for having me.
I know both of us have teen girls, and I know this is a teenage problem, but more and more you're seeing acne flare-ups in adults.
Yeah, definitely. So we get a lot of patients coming into the clinic and their main concern is acne that is a newer onset in adulthood.
Okay, and so what do we need to understand about why we might all of a sudden have acne flare-ups?
Yeah, so a lot of those cases are hormonal for sure, and one of the first conditions to really rule out would be PCOS or polycystic ovarian syndrome, and that can be done through blood testing and a series of questions looking at clinical history. But sometimes patients are sort of in a gray area and they may not have all the criteria for PCOS, but they're producing too much what we call androgens. So like too much testosterone, DHEA, or maybe having issues clearing estrogen, detoxifying estrogen, and we can test for all of that. So testing comes in really handy looking at that hormonal profile.
And this is something, if you're just going to the dermatologist, they might not be offering hormone testing. I mean, a traditional doctor might say, let's try some birth control, which could actually be an option for PCOS, for hormones. But so this is something that if you go to a naturopathic physician, or like yourself, a naturopathic physician, expert in integrative medicine at Whole Health Wellness in Farmington, you would actually drill down a little bit. You're trying to find the root cause.
Right, exactly. So we would look at hormones, but then we're also really looking at gut health, because we know gut health on its own can be a problem, but that can be what could be causing some of the hormonal issues too, and it could be a combination of things. So then we're looking at microbiome testing, digestive analysis, and then food sensitivity testing as well.
Okay, so let's say it's step one, we're breaking out, and this happens to men and women, but you're seeing it more in women.
For sure, the numbers are documented to be a lot higher in women.
And a lot of moms too, is it triggered by pregnancy at all?
It can be, so that could trigger some hormonal change and stress, which affects our hormones. So certainly women who are saying I'm breaking out before my period, or mid-cycle onward, there's definitely a hormonal component just based on that history.
Okay, so step one, we're going to maybe do some testing. And what type of test would you start with?
Yeah, so we could start with just regular blood testing through Quest or a LabCorp. And so there we could do some hormone testing. It's not as comprehensive. We might do some advanced, and that's where we start thinking about these functional kits. We can look at vitamins as well. So we can look at things like vitamin D and A and vitamin K and B and zinc and omega-3s. There's a lot of different vitamins that can affect your skin in terms of acne. And you can do a little bit of food sensitivity testing, but it's not really that accurate there.
So food sensitivity could be a big deal. In fact, you're finding that step one, before you even do the testing, dairy can be a big trigger for a lot of folks struggling with acne.
Yeah, unfortunately, nobody wants to hear that.
Yeah.
Because there's a lot of really great, dairy products that people love and depend on. But it is one of those foods that could be creating a lot of inflammation in the gut, and there's some good evidence to suggest that, functional dermatologists who have done some of this research and show cutting out dairy can make a big difference, even if it doesn't show up as a food sensitivity. So you could just try that first, and that's what I'll encourage patients to do, or at least really limit it. Same thing for teens.
How long do we need to cut it out till we notice a difference?
So you really need to cut it out for 4 to 6 weeks, solidly cut it out. And so it's a bit of a commitment, but it's not a forever thing.
So sometimes when I've done some detoxing, we'll cut out dairy, but they'll say it's okay to have a little bit of Greek yogurt because that's more of a probiotic. Would that be the same or nothing?
Yeah, no, because it still have those proteins there, so it's not the same. But a lot of times people could maybe tolerate a different form of dairy. So instead of the cow's milk dairy, a lot of times people could have maybe a little bit of goat's cheese or sheep milk like feta, because the proteins are a little bit different in there.
Okay, so here's a test. If you just want to have, I find when you do these testing, sometimes it's just a little bit more oomph to make you actually do this, because if a test comes back and says you've got an issue, you might comply more. And so this is the FIT test, and it's going to look at our gut.
Yeah, so it looks at 2 different things. So we'll actually look at food sensitivities. We can test for 176 different foods. So there's no way you'd ever identify anything like that. I mean, I've had patients with this coming back that they're sensitive only to coffee and cinnamon. Like, you'd never really identify that without doing this type of test. But it also has a gut barrier panel on there, so it screens for some issues related to leaky gut and even candida on this one.
Okay, so let's just back up. If you might be hearing that in magazines a lot, leaky gut. What exactly is a leaky gut? Because I think so many times that becomes the all-encompassing, oh, you might have leaky gut. And probably a lot of us do with the way we're eating an American diet, right?
Yeah. So it comes down to inflammation, but not everybody has a leaky gut. These questionnaires where you can fill out, online, and it diagnoses you as having a leaky gut is not valid. There's actually testing that needs to be done to actually confirm whether that is the case. But basically it means that your intestinal cells are not like as tight together as they should be, so they're a little bit apart, and that allows bigger proteins to come through between cells, which normally shouldn't come through, and that can create a whole cascade of inflammation and can even lead to autoimmune disease.
Okay, so our gut should be solid, but instead it might look a little bit more like a strainer.
Yeah.
Okay.
Yeah,
and the bottom line is inflammation is the driver of everything. So when we think of acne, a lot of us were worried when we were younger about washing our face and everything external, but our skin is really a reflection of everything going on the inside.
For sure, yeah. And acne is defined as an inflammatory skin condition. So we really want to think about like what can be creating inflammation. So even when you have a leaky gut, you have to figure out why it's leaky. So food sensitivity can cause it to be leaky, first of all, and then it can kind of result in more food sensitivity, so that can kind of snowball. But it can be other things. It can just be like dietary signals and lack of good dietary signals. So eating the standard American diet is basically inflammatory. So eating a lot of processed foods, eating a lot of food additives. Food additives have been shown to disrupt your microbiome, and so with a poor microbiome, that leads to inflammation as well.
Okay, so the FIT test is one thing we can do. Eliminating dairy, another thing. And of course, the success is what drives people to want to do this. Another thing, I've seen a lot about this is Dutch test. And this is kind of the gold standard to do hormone testing?
Yeah, so you can start off by doing some like blood levels of hormones, and that would tell us things like estrogen and progesterone and testosterone levels. You can do those standard sorts of testing through, a Quest or LabCorp. This is a lot more detailed. It tells us more about how those hormones get broken down in our body and detoxified, basically. So you can end up with more of a sort of negative estrogen metabolite, and that can wreak havoc in your body.
Okay.
And that could cause symptoms that come out on your skin, for example.
So what if a lot of women are already on birth control for lots of different reasons? Can you still take hormone tests if you're taking birth control because it's controlling your hormones?
Yeah, so it will give you some level of information, but if you're going to take a birth control pill, then we'd probably more so focus on gut health. So there's still things that we can do to support the birth control, but that is altering your hormone levels. Now, that doesn't mean there's nothing else you can do if you're on a birth control pill. We see this all the time in our practice, that patients come in and they have PCOS, they're on birth control, they're still having breakouts. Then we do things like probiotics and do a microbiome assessment and really like dig further into gut health there.
Okay, so we've got the food, the triggers, hormones, whether you're going to balance them with naturally or you're already getting those hormones taken care of because your doctor put you on a birth control for some hormonal fluctuations. Next, we go to the gut. And so often, you get prescribed an antibiotic from a traditional doc.
Yeah.
That happened to me in college. I was breaking out a lot. They said, oh, just take it every day for a few months. And that can be really disrupting to take an antibiotic every day, because then you get these other problems like yeast infections and things like that. So if you don't want to do that, or you want to really get to the root cause of clearing up the gut, what would be step one for that?
Yeah, so it would be, we can use natural antimicrobials, basically. So ADP is one of my favorite ones to use, and that's an enteric time-released oregano oil, so oil of oregano. And that works as an antimicrobial. It will kill bacteria, it will kill yeast, but it doesn't dampen down your good bacteria. So it's only going to control for not so good bacteria, bacteria that's growing out of control. It's not going to disrupt your microbiome. On its own, it also has an anti-inflammatory effect. And that's kind of interesting about a lot of times when you're prescribed antibiotics now, the first round that you get from a dermatologist, they're very low dose and they're designed to sit in the gut and not be absorbed. And more of the research on it is showing that it's more having an anti-inflammatory effect than necessarily really being a strong antibiotic, like killing bacteria. However, it still does some of that. So this is a great option here where we use oregano oil instead of using a prescription antibiotic.
And if you've seen other shows with Dr. Stagg, the oregano oil is also something that helps us when we're starting to get sick.
Yes.
You pound the oregano. I've done this myself. I really think I have avoided sickness, and my kids think I'm crazy, but I'm like, here, take the oregano, and they often are getting better. So this is something that, again, this you can get this at Whole Health, and that's where your practice is, but I have found it online on Amazon, and you would take, what would be a good dosage to experiment with for acne?
For acne, we use a high dose, so similar to how we dose it for like a respiratory infection when you're coming down with something. I often have patients do like 6 a day, 4 to 6 a day for about a month to 6 weeks, and sometimes some patients will keep them on there a little bit longer, or maybe like lower the dose a little bit longer and keep them on it. But I've seen that work really well for a lot of patients.
Okay. Would you try that with your teens as well?
Yep. Yeah, for sure. So you could definitely do that sort of product on it with a teenager.
And is it okay for people who are on other medications like birth control?
Yeah, there's no interaction with oregano oil and birth control. That would be fine.
What about, I've had questions from ladies in the newsroom about this because they all want to take it too as well. They've seen some success. But can you take it if you're nursing?
I probably wouldn't.
Okay.
I'm really cautious about what people take when they're nursing.
Yeah.
Yeah.
Now, if you're nursing and you're dealing, I mean, you know, maybe you're going to prioritize because you're nursing a young baby, but if you are having a lot of acne, some of these other things, you might not do the testing and all that hormone when you're nursing, but what about probiotics and things like that?
Right. So like nursing women, the way to go is definitely, and a lot of times with teens, and one of the first things we do with anyone with adult acne is to use like a probiotic, like an Ultraflora. The balance of probiotics that are in there, lactobacillus and bifidobacteria, strain identified, they work really well to handle even like a lot of like cystic acne. I've had patients who really notice a big difference using that in a higher dose, and that would be safe to do in
What would
pregnancy.
be a higher dose? This is the Ultraflora Balance by Metagenics.
Yep.
I know you sell that there, but again, people can go on the Metagenics website and look this up. What would you recommend for acne?
Yeah, so I probably would do, if we're trying to really decide if this is going to work for someone, start with Ultraflora IB, which is 4 times as strong as Ultraflora Balance. So you'd have to take 4 of those to equate 1 capsule of IB.
Okay.
And that is a really good dose for like acne control. And again, very safe. You can do that for a long time. No worries about safety there.
And it's helping your overall health too, because a lot of us need the probiotics for other things.
Yep.
So this is also, you might be finding rosacea, redness, pustules, like everything we're talking about could be good for those things as well.
Yeah, for sure. So when patients have rosacea, it's a little bit of a different profile. A lot of times they'll notice that they're having like a lot of redness in their cheeks. It could be pustular. There could be actually like a skin infection, like mites basically, little tiny bugs that live on your skin. Ew. And then a topical, I'm fine with patients doing a topical for that because it often can really like clear it up and work really well. And it is just like a topical, like anti-parasitic type medicine that's used.
How would you know if that's what's causing it?
It is, you don't know unless you do the treatment, but a lot of times with pustular rosacea, it is like a mite that lives on the skin, and it's basically like feeding on the serum in your eye.
Oh, goodness gracious.
But it's a pretty, like, it's a mild, it's not a strong treatment. It's like, it's fine to do. But one thing about rosacea is that for many of those patients, we screen them to make sure they have adequate levels of stomach acid. So having low hydrochloric acid in the stomach, it has been associated with rosacea. So we check for that and then potentially need to supplement with hydrochloric acid, that you take these pills when you eat your meal. That should really not be done on your own. You really should seek out a naturopathic doctor to help you out with that, because you can get into trouble if you don't know what you're doing there.
Yeah, so we obviously are taking a deep dive, and but just to catch everybody up right now, if gold standard, we can go see you, Dr. Stagg. You see people from all over Connecticut and all over the country, really, because a lot of it, the blood testing can be done virtually. But even if you call Whole Health Center and you can't get an appointment right now, or you don't want to do that, or whatever, you can just start with, let's eliminate dairy, let's try some of the ADP and the probiotics. And those three things together, for about 4 to 6 weeks, you might notice a drastic difference.
Yes, for sure. You should start to notice some changes, and then really over the course of like 3-4 months, really with the probiotics, it should continue to be like in continual improvement there. Okay. And then of course, like what you're using topically, like watching out for that. I know we were talking about overwashing, those sorts of things, and what you're using on your face that could create its own issue.
So yeah, so lifestyle, a little different from what we've imagined. I was joking that when I was younger and started to break out, my mom handed me a bottle of, the 1006 toner that smelled like rubbing alcohol, and you're like rubbing it. So actually using really harsh products disrupt our hormones, strip the oil, and make it worse.
Yeah, exactly. And so then if you're overwashing your face, like washing your face like 2, 3, sometimes I see patients are washing it like 4 times a day. They're washing off makeup and putting on makeup multiple times. That is, it's stripping oil, and then your oil producing glands, which also where the bacteria live that cause acne, are just overproducing. So now you're just like trying to pump out oils, and that creates like more inflammation, more acne. So I advise for my adult patients to wash at night, and then in the morning just like touch up with wash and moisturize, of course, and then moisturize again in the morning. And then if you're putting on makeup, put that makeup on, then you're washing it off at night.
Okay, so at night you do your washing. That's when you're like gonna do your skincare routine, which we'll get to we're not talking about the TikTok 12-step skin routine. We just wanna clean it gently.
Yes.
And then we wanna put on some moisturizer. I use CeraVe. Like you want something that doesn't have a lot of stuff in it, a lot of fragrances. You want, is it okay to have oils? That's the controversy. Oil-free, not oil-free.
Yeah, I don't think that that's necessarily a problem. It's more about like a really balanced product that doesn't have like parabens and phthalates and all these like hormone disruptors in there. So I really like these Glowbiotics products.
Okay.
They are probiotic balanced, so they're enhancing the bacteria that's also on your skin. So we have like good bacteria in our gut. We also have that on our skin. So you can get, they have a big line of products. They have just like a regular, really moisturizing cleanser. They have it with salicylic acid. So in some cases, we might consider doing a salicylic acid and then balancing it out with a really hydrating moisturizer.
Okay, so Glowbiotics, and this is again something you have at your facility for your patients, at your center, Whole Health Wellness in Farmington. But can you look Glowbiotics up online?
Yep, yeah, okay. You can definitely buy that online as well.
Is that why you're glowing? Do you use Glowbiotics?
Yeah, I do use Glowbiotics. And it was actually
Isn't
like
she
my
glowing?
friend who's a dermatologist carries this in her practice, and then like introduced it to me, and I was like, I love this stuff, of course.
And you
like
give it to your girls too?
Yeah, my kids all use this. Even my son, who's in college, he uses it.
And he
as
notices,
his wash.
and he's okay.
Oh yeah, they love it.
They love it.
It is so hydrating. And we just all use the like revitalizing face wash, not the salicylic acid one.
Okay, so again, you don't want to overwash. Now, exfoliation, that's a whole dermatologist issue, but that always made a difference for me. Like just making, I was told, even taking a clean washcloth and just going in circles. But if you're getting lots of dead skin, and kids are doing sports, or you're going to the gym, I think that's the problem with the overwashing. Like, what do we do after we're working out and we feel all?
Yeah, exactly. So yeah, there are gentle ways to exfoliate the skin. So you could do something that is more of like it's a mechanical disruption, but then there are products that have like AHA, like gentle fruit oils, glycolic acid, but again, you don't want to overuse those too. So
start with
again, all
gentle.
about balance.
Start with gentle and avoid, just like we're trying to avoid all the red dyes or things like that, you would actually really advocate as a naturopathic doctor, look what the ingredients are, because a lot of the stuff might have those endocrine disruptors, all the products we're using, and that can make it worse.
Right, yeah, and it can have like long-term health consequences as well. So really watch out, especially with teenage girls, what they're using, because yeah, long term, we don't know what this stuff does over the course of many years for fertility, and you know, there's a lot of evidence for like increasing premature ovarian failure, so women going into menopause early, and it's thought to be like environmental cause.
Oh goodness. So right, and I worry about that so much for my daughter, and we've done so many stories about endocrine disruptors, but we're also battling TikTok. Not just, I mean, moms, we're on here too going, what's the latest thing?
Right.
But I mean, you've got 10-year-olds doing a 10-step skincare program now. So a lot of what you're seeing on social media, a lot of the brands that everyone is getting at Sephora, could that be making it worse?
Yeah, because it is like a lot of those products are designed for like older skin, right? It's not designed for a 10 or 12-year-old to use. And I'll see this even like myself, how dermatologists, a lot of skincare experts are really on a bandwagon of like, stop using these products. It's harsh on young skin. And
they don't need vitamin C serums and you know, all these things
peels
peels. I mean, so, and if you're struggling with acne also, we want to make sure that we're not aggravating the skin. So let's go back to the diet. If there's one diet that you should be on that really would be pro for your health, which I guess would be pro to heal acne, is there a certain way we should be eating that can help get rid of our acne? Yeah,
so I would say Mediterranean diet is the way to go, and I think I'm like a broken record because I say that almost about everything.
Well, it's always ruled as the most tested diet. Clinically, they always say it helps against disease. So it's an anti-inflammatory Mediterranean diet.
Right.
But what does that mean? People don't know what that means.
Yeah, it means, and the thing about Mediterranean, yes, it has a lot of fruits and vegetables, but one key thing about a Mediterranean diet is it also is rich in healthy oils. So olive oil, nuts and seeds, and those oils are really important for our skin. So omega-6s, omega-3s, all of that is really important for skin health and for reducing inflammation. So just like the way that skin cells like multiply and stay healthy, as well as keeping like our gut inflammation down. That is really important when it comes to acne.
Right. So eating more fruits and vegetables, eat the rainbow, and sugar. Sugar can be a big acne trigger. We really need to cut down on sugar.
Yeah, because it's inflammatory. Like we know, too much like starch and sugar in the diet, processed foods with a lot of additives, devoid of these phytochemicals that are found in whole foods, are going to cause inflammation in the gut.
What about this? This is one product we didn't talk to. Estrofactors, targeted support for healthy estrogen metabolism. We hear a lot about the bad estrogen, especially as we get into our 30s, 40s, 50s. With perimenopause and menopause.
Yeah, so this is kind of that concept when you hear people talking about estrogen dominance, and that can happen in a couple of different ways, where there's too much estrogen, not enough progesterone, but for most people, it is an issue with detoxifying and clearing the estrogen that you produce in your own body to eliminate it, basically. So we make these hormones in our body, we have to detoxify them for them to get out. And in that process of detoxification, you can end up with an imbalance of estrogen metabolites that are bad estrogens. And so this particular product, and there's a couple of really great products out there that do this, but this is probably one of my favorites, Estrofactors. And what that does is it works on those pathways in the liver and supports gut health as well, because that's involved, and allows us to clear that estrogen out so we're not building up these negative estrogens.
So before I go, I want to do our 3 takeaways, because I love to give people some action steps. But some of these tests, the KBMO Fit Test, the Dutch Plus, this is a Massachusetts company. Can you just get this on your own? Do you need to get it through a doctor?
I think you can only get that through a doctor. I don't
Okay.
think it is direct to consumer. Yeah.
Okay, so you could find whichever.
But there's lots of like, I mean, obviously through naturopathic doctors, but there are functional MDs and nurse practitioners that you would be able to get that through. But you can just look up the company and find a provider who would be able to get that.
So just go to www.kbmod, KBMO Diagnostics.com, and they can maybe find the provider if there's some of these tests that you really want to get. So as we kind of close out in our time here, if you're talking to women out there who are struggling, give us your 3 top action steps you would do right now.
Yeah, so I would like clean up my diet for sure.
Yeah.
Like really go Mediterranean, cut out the sugar and processed foods. I would say that's key. Watch your skincare routine. I think that's a big issue for a lot of women. And then I would really start to like figure out, like, probably see a healthcare provider, a functional like naturopathic doctor, to figure out, is this a gut issue? Is it hormones? Like what to prioritize how to treat it.
Okay, yeah. So we definitely want to weed and seed. Weed out the bad stuff, start seeding it with the probiotics, the good food, all of that. And we all get impatient. We want it gone yesterday.
Right.
But how long until we can at least notice that it's working?
Yeah, we usually see some change over the course of like the first month, that there's a little bit of a change, and each subsequent month we'll see additional change. So it's not going to be like typically for most people like 50% better in a month, but 20%, 25% better in a month is great. I mean, sometimes we see really big improvements, and that's great, but on average, you know, like you'll get a little bit better each month.
One thing we didn't mention yet, and I want to make sure we do before, besides all the bacteria, it could be candida. And if you have a lot of tiny little zits all over your back, your chest, I saw this with my son, you might have a candida issue, and then that actually does respond well to a medication, a prescription.
Yeah, exactly. So there is a type of basically like yeast acne called pityrosporum, specifically is what that is, and it is like candida. It's a yeast, and it looks really like light colored and bumpy, and sometimes it can look a little bit red, have a little bit of inflammation to it. But taking like oral medication
like
for
diflucan
can really like reduce the amount of that yeast on the skin, and then there are topicals that can be prescribed as well.
Okay, so lots to learn. Acne is not just, it's not just the fact that you forgot to wash your face last night, although you should do that, and not just, we want to make sure those makeup brushes, but we really don't need, in fact, it might be making it worse, all those TikTok trends.
Yeah.
We need to simplify and let our inflammation come down, and then we start to see a big improvement.
Yeah, exactly. Like you're not really going to cure acne through your skincare routine when a lot of it is like gut related and hormones, right? You really have to think of that inside out approach.
Okay, so this is applying to both women and men who are seeing it as adults, or if you want to listen to this episode on the podcast, the CURES podcast, or if you're watching on WFSB Plus or the Wax, share it maybe with your teens, because maybe that will make them understand why you don't want them eating Chick-fil-A all the time.
Yeah, pretty much.
Right?
Yeah.
The battles. Okay. All right, well, thank you all for joining us for Kara's Cures, where we explore the cutting edge of wellness. Please follow me at Kara Sundlin. I love to share this content there. Have a great day, everyone, and be well.